Human immunodeficiency virus, or HIV, targets the body's immune system. If untreated, it can lead to acquired immunodeficiency syndrome, or AIDS. Having HIV does not automatically mean a person has AIDS. AIDS is the late stage of HIV infection when the immune system is badly damaged. Many people with HIV live long and healthy lives with proper treatment. HIV is primarily transmitted through certain body fluids like blood, semen, and vaginal fluids. These fluids must come into contact with a mucous membrane or damaged tissue, or be directly injected into the bloodstream. It is not spread through casual contact like hugging or sharing toilets. Knowing how it spreads helps us understand how to prevent it effectively. Globally, HIV remains a significant public health issue. Millions of people are living with HIV worldwide. Sub-Saharan Africa remains the most affected region. Antiretroviral therapy, or ARI, has transformed HIV from a fatal diagnosis to a manageable chronic condition. However, access to testing, treatment, and care is not universal. Stigma and discrimination remain significant barriers. Addressing these social and structural factors is as important as medical intervention. We must work on all fronts to combat this virus effectively. Supporting those affected is crucial. HIV targets CD4 T lymphocytes, crucial white blood cells in our immune system. These cells lead the fight against infections and diseases. HIV infects these cells, replicating and destroying them. As HIV multiplies, CD4 cell count decreases, weakening the immune system. A healthy person has a CD4 count between 500 and 1500 cells per cubic millimeter of blood. When this count drops, the immune system weakens. Opportunistic infections and cancers take advantage of this weakened state. The progression from HIV to AIDS is marked by a significant drop in CD4 cell count or the presence of specific opportunistic infections. Modern antiretroviral therapy, ART, stops the virus from replicating. This allows the CD4 cell count to recover and the immune system to strengthen. ART can prevent or significantly delay the progression to AIDS. Early diagnosis and treatment are vital. This helps maintain a higher quality of life for people living with HIV. Understanding HIV's operation is key to managing it effectively. Opportunistic infections, or OIs, are a major concern for individuals with advanced HIV infection. These infections are caused by pathogens that usually do not affect people with healthy immune systems. When HIV depletes CD4 cells, these organisms can cause severe illnesses. One common OI is pneumocystis pneumonia, PCP, a fungal infection of the lungs. Symptoms include fever, cough, and difficulty breathing. Tuberculosis, TB, is another significant OI, more likely to develop in people with HIV. Co-infection with HIV and TB is a major global health challenge. Candidiasis, a fungal infection, can affect the mouth, throat, esophagus, or vagina. Cytomegalovirus, CMV, can cause serious problems in people with advanced HIV, affecting the eyes, digestive tract, or brain. Preventing and treating OIs is a key part of HIV care. ART is the primary way to prevent OIs by strengthening the immune system. Doctors may prescribe prophylactic medications for individuals with very low CD4 counts. Early diagnosis and treatment of any OI are crucial. Regular medical checkups help monitor for signs of these infections. This proactive approach saves lives and improves health outcomes. People living with HIV face an increased risk of certain cancers known as HIV-associated cancers. These cancers occur when the immune system is weakened. Kaposi's sarcoma, KS, is a well-known HIV-associated cancer caused by human herpes virus 8, HHV8. KS appears as purplish or brown lesions on the skin, and can affect internal organs. Non-Hodgkin lymphoma, NHL, and Hodgkin lymphoma are cancers of the lymphatic system, more common in people with HIV. The Epstein-Barr virus, EBV, is often implicated in these lymphomas. Symptoms include swollen lymph nodes, fever, and weight loss. Invasive cervical cancer is also an AIDS-defining cancer in women with HIV, primarily caused by human papillomavirus, HPV. Regular Pap smears or HPV testing are important for women with HIV. Early detection and treatment of precancerous lesions can prevent cervical cancer. Understanding the link between HIV and these cancers is vital for comprehensive care. Regular screenings and early treatment are crucial. This highlights the need for gender-specific cancer screening in HIV care. Beyond opportunistic infections and cancers, HIV can affect nearly every system in the body. People with HIV may experience long-term health issues even on effective treatment. Neurological complications can range from mild cognitive difficulties to severe conditions like dementia. Peripheral neuropathy, causing pain or numbness in the hands and feet, is also common. Cardiovascular disease, including heart attacks and strokes, is another concern. People with HIV have a higher risk of heart disease due to chronic inflammation, medication side effects, and traditional risk factors. Managing cardiovascular risk factors is critical. Kidney disease, specifically HIV-associated nephropathy, HIV, can be a serious complication. Regular monitoring of kidney function is essential. Early detection and management of kidney problems help preserve kidney health. Awareness of these broader health implications is important. Comprehensive health management is key. This includes regular screenings and a proactive approach to overall health. Understanding the prevalence of HIV complications through statistics helps grasp the scale of the challenge. Before widespread antiretroviral therapy, opportunistic infections were extremely common. Today, thanks to ART, the incidence of most OIs has dramatically decreased. Despite progress, OIs still occur, particularly in individuals diagnosed late or not on sustained treatment. Tuberculosis remains the leading cause of death among people with HIV. Early HIV testing and linkage to care can prevent many TB-related deaths. Regarding HIV-associated cancers, rates have declined with ART, but the risk remains elevated. People with HIV still have a higher risk of developing Kaposi's sarcoma, non-Hodgkin lymphoma, and cervical cancer. Non-AIDS defining conditions like cardiovascular disease and kidney disease are increasingly reported. People with HIV may experience these conditions at an earlier age. Comprehensive care addresses not just viral suppression but also long-term health challenges. Vigilance and proactive management are essential. Early detection of HIV is crucial. The sooner an individual knows their HIV status, the sooner they can begin treatment. Starting antiretroviral therapy early helps preserve immune function. It reduces the risk of developing opportunistic infections and other complications. Early diagnosis also prevents further transmission of the virus. Regular medical checkups are important for people living with HIV. These appointments monitor the effectiveness of ART. Consistent monitoring ensures that the treatment is working optimally. If the viral load is not suppressed, adjustments to the treatment plan may be necessary. Regular visits also screen for potential complications. Early detection of issues leads to more effective treatment. Open communication with healthcare providers is key. This ensures the care plan is tailored to the individual's needs. Empowering patients with information and support is crucial. Knowledge and consistent care are powerful allies. Managing HIV and its complications requires a comprehensive and proactive strategy. The cornerstone of this management is antiretroviral therapy, ART. ART involves taking a combination of HIV medicines daily. Adherence to ART is critical. Missing doses can allow the virus to multiply. Prevention of opportunistic infections is paramount. This might involve taking prophylactic medications and vaccinations. Diligent screening and early treatment for emerging complications are vital. A multidisciplinary team approach is beneficial in managing complex cases. A healthy lifestyle plays a significant role in managing HIV. This includes a balanced diet, regular exercise, and mental health support. Support groups and counseling can provide valuable assistance. Combining medical treatment with proactive health management improves long-term health. Individuals living with HIV can significantly improve their quality of life. Understanding HIV complications is essential for everyone. While HIV remains a serious global health issue, remarkable progress has been made. Antiretroviral therapy has transformed HIV into a manageable chronic condition. This allows people living with HIV to lead long and fulfilling lives. However, the risk of complications still exists. Awareness is our first line of defense. Early detection and regular medical care are paramount. Knowing your HIV status allows for prompt initiation of treatment. Consistent medical follow-up ensures that treatment remains effective. We must continue to promote widespread HIV testing and ensure access to quality care. Management strategies involve strict adherence to ART, preventive measures, and a healthy lifestyle. The journey of living with HIV requires a proactive partnership between the individual and their healthcare team. With ongoing research, treatments continue to improve. There is great reason for hope, but our efforts must not wane. Vigilance and compassion must guide our way.